So the new score includes the clinical parameters of systolic blood pressure, oxygen saturations, temperature and pulse rate, and all these things can be a really clear indicator of how well or not well a patient is. So in a situation, if a patient is deteriorating or the care home staff feel that the patient is deteriorating, the new score gives a really clear and valid help if you're on the end of the telephone, because you will be able to see quite clearly if they're deteriorating. It's not a alternative for professional judgment or even knowing the patient, but it really helps when you're very clearly trying to define how well or unwell a patient is.
Well, from our job role we have access to the database, so we can see from our office remotely how the homes are doing with the kit. So we can see the baselines and we can see the recent readings, so we can see if someone's a bit off the baseline and we can monitor it from afar. And then also if the home ring us, then we can obviously see what they're seeing as well, rather than having to go through it all. We can just say, oh yeah, I can see it from here.
The technology in Farnborough Court has helped improve patient care. It's identified when a patient's becoming unwell and deteriorating. It allows the care staff or the nursing staff to act on what they find by either coming to speak to me, the nurse practitioner, or the GP who visits daily.
As a support worker at Farnborough Court, the technology has helped by helping us pick up on patients, on how they're feeling, and if they're unwell, we can just get the kit out and see how they're doing.
The technology has made a big difference to patients, them that's poorly, what route to take, either nurse practitioner, GP or A&E. So you act on their scoring.
So it's been about 6 months since the kit's been embedded in most of our homes, and since then I've noticed that when the homes are ringing recovery at home and GP surgeries, when they've got the observations behind them, they've kind of got more of a handover, and then it's easier for them when the GP's saying, so what is the problem, what's off from normal. The homes have something behind them so they can say the blood pressure's off, usually it's this and now it's this. So I think when they are worried, they're getting the response quicker.
It's helped us in the care home by getting appropriate care to patients and customers in a timely manner.
The technology has helped us for us to be aware that if there's a situation where one of the residents is poorly, we can go back on what the score was before that and what it is now. So then if we find there is a huge difference, we can inform the local GPs for advice.
As a senior lead, I do the baselines for the new score. The residents feel confident that we do this every month, and it's made a difference because they know we're going to pick up on illnesses quicker.
Our care settings seen massive benefits to our residents that live there. It will immediately flag up either you log onto your website or you calculate your news scores. Based on that, it'll tell us when and how and what services to use to get the people the right treatment on time.
It's made a big difference to the residents and patients of Farnborough Court because it's improved patient care by identifying when they're becoming unwell, and we can act on that immediately.
It's made a difference by helping us monitor how they are, so it's improved the quality of care.
It means that we're getting appropriate care quickly to that person by what the new score is.
It makes a difference because the residents feel more comfortable and confident in the staff, knowing that they're being looked after, knowing they do these observations on them regularly.
It's reassuring that it's there if we have to use it. And it's also a reassurance for families as well, knowing that we're on top of observations each month.
So just last week we had a patient who was just presenting unwell and she couldn't really tell us any symptoms at the time. So we did our obs and a national early warning score come back as a 6. So it just helped us get to the nurses and helped the nurses then put it as a priority.
An example of me actually using the kit has probably been on a daily basis, but one in particular was a patient who I identified was probably having sepsis, and by using the kit to monitor the patient's blood pressure, pulse, temperature, respiration rate, SATs, I was able to confirm the diagnosis and send the patient to hospital immediately.
In Farnborough Court we use the kit throughout the day, throughout our daily duties. One of the examples would be a customer was presenting generally unwell. we did their observations, got the new score from that. We then escalated that to the nursing team, who then gave us direction to continue to take that observation for that person throughout the duty.
In our care setting, we use the kit monthly to record baselines, and more often than not, it will flag up that these differences before we even know the onset's happened.
I had a gentleman in the home who didn't look very well. We'd done his observations with the new score. It differed from his baseline. His oxygen levels were low. We contacted the GP. The GP visited and got this gentleman into hospital straight away.
It's made a huge difference because we didn't have that before. We were just using observations, as in blood pressures, temperatures. But now that we've got the new score, we can take that number against what was the previous number and again previous to that, and see if there's any changes.
If anybody appears unwell, the new score is recalculated and compared against the baseline. That will immediately tell us if anybody is suffering from any onset of any illnesses. We will investigate, we know what services to use, and services now are on board with new scores over the phone, which has made a massive difference in our treatment to get everybody.
So from our point of view as the NHS Trust, as a team of nurses, we can definitely see the benefits. I think there's a while to go yet, but the homes are definitely getting there with some support from us and the more experienced members of their teams. I think we can definitely get there. I think it's better for the patient because they're being prioritised really. They can see who needs someone quicker and they can ring the surgery and get better results.
As a GP, I really feel that the news score has helped. It helps provide continuity of clinical scores with each patient, both from a deterioration perspective and also just to monitor people who have really poor scores to make sure that we don't overreact if they continue to have poor scores. So I think this works especially with agency staff who may not know the patient very well, so it really helps with continuity of care.